CeraVe beauties. Today I'm talking my experience with radiation and tips on how to keep your skin hydrated during the process. Now, I was lucky enough to be able to do proton therapy, so I did not do general x-ray or your standard x-ray radiation therapy. The difference between the two, as it was explained to me, is that x-ray radiation typically goes through the target and protons hit their target and they stop. For me, the damage to my heart would have been too severe if I would have done x-ray therapy, so proton therapy was really our only option in terms of radiation. I had 25 sessions of proton therapy every day, Monday through Friday, at random times, so that was always fun. I had an incredible team at the Florida Proton Therapy Institute. I believe I'm saying that right. They were incredible, and I looked forward to meeting with my team every day. Prior to starting radiation, I went in for what is called a simulation, where you go in to do your body cast. Now, this was particularly tough for me. I remember crying in the dressing room afterwards because I had not yet started physical therapy. So if you are having any kind of serious surgery, especially if you're having like a mastectomy, for me, I had a bilateral mastectomy, so both of my arms were affected. I think it's extremely important to make sure you do physical therapy and get your arms moving as soon as possible, because you have to have your arms in a comfortable position during your radiation therapy, and it has to be in the same position every day. So when I went in to do my simulation, I definitely struggled a little bit. The radiation simulation happens about a couple of weeks before you actually start. For me, there was a larger gap because we weren't sure whether I was going to have to do radiation or not, so I had like that couple of weeks between my simulation and actually getting started to go to physical therapy, and I think I went like 2 or 3 times a week. During the simulation, they talk to you about what to expect during radiation. They put you in position, you make your body cast, you get as comfortable as you can. If I would have had to do general x-ray therapy, because they were trying to limit the damage to my heart, they did prep me for the breathing mechanism, where you have to hold your breath for a certain amount of time so they can do the ray and then release. I will tell you, not knowing that I was gonna have to do that totally freaked me out when I got in there, because I was like, I don't know if I'm gonna be able to hold my breath long enough over and over again, but I did it for the simulation, and I was lucky that I didn't have to do it every day, because that would have totally sucked. Going into radiation every day was a little bit of a process. Getting set up some days was a little bit of a process. Some days took much longer than others because just what you wear. I just started to wear leggings a lot. What you wear makes a big difference in how you set up. How you lay down makes a big difference in how you set up. And then my expanders, the magnets were moving. Just the general everyday usage, I guess you could say. Laying down, sitting up, physical therapy, things were shifting, and sometimes it was tough. It was challenging. In terms of work, I did not work during radiation. I really wanted to give myself time to heal and time to experience whatever it was that I was going to experience. I did not know what to expect. It took about 2 out of the 5 weeks before I really started to feel tired. And when I tell you I felt tired, I mean I was up at 9 o'clock, and by 11 o'clock I needed a nap. I slept a lot during radiation, and that tiredness lasted for about a month after I finished radiation. Not as bad as when it first hit, but it definitely lingered. So in terms of how my skin actually changed during radiation and during the 5 weeks, it was explained to me by a plastic surgeon that Black women typically have a stronger response to radiation in general, and proton therapy, as I said earlier, typically has a harsh cosmetic effect. For someone that had or that's looking to do reconstruction surgery, that was terrifying to hear, because I had to keep my expanders in to do radiation. We had to make sure that I was as full as I wanted to be during radiation. But I tell you guys, my experience was not that bad. I actually did very well with radiation, and here's how. CeraVe is bae. I will say it again. CeraVe is bae. I started using CeraVe like as soon as I found out that I had to do radiation, and during radiation, up until I started having skin breaks, which wasn't until about week 4 out of 5. I used CeraVe twice a day, in the morning before my treatments and at night after I showered. In terms of how my skin fared during radiation, I actually didn't start having skin breaks until about week 4 out of 5, which is pretty good. I do have some pictures I'll throw in. I will try not to throw anything graphic, and so I won't show you guys skin breaks. But I was not ready for the skin breaks. They terrified me. They say the weeks after radiation were the worst, and I will co-sign that. It was the last 2 weeks after my 5th week where I was like miserable. Somewhere around week 5 and 6, it was just a matter of like everything hurt. It was a constant pain. I sometimes had random sensations of burning. It was miserable, and I told my doctors and they gave me some pain meds, but for the most part it was a constant pain, and it was just something that I dealt with. I will say that it didn't last long. They gave me the pain medicine. I think I only used it for like 3 days. And then my skin started to turn the corner. And so that last week, let's say around week 7, week 8, is when my skin really started to heal. And in terms of healing, it's basically the top layer of skin. For me, the top layer of skin definitely came off. And it was terrifying to look at. But because I've had mastectomy, I had no feeling in an awful lot of places. So what was the most uncomfortable, or a lot of the discomfort I felt, was like deep internal aches. They weren't like surface pain kind of things. With the exception of under my breast and between, because I still have feeling in between my breast and up under. So that sucked. At the first places that I felt, or places that I could, the first places that started to break were the places that I could feel. When my skin started to break is when I changed my skin routine. So I used CeraVe, like I said, up until I started to have skin breaks, and my skin the top layer started to come off. When the top layer started to come off, it's really more like a burn, so we started treating it like it was a burn. The 2 things that I used to help me get through those last couple of weeks, and really just to help aid the healing process until everything, as you can see, like it's all flat surfaced, one level now, and you'll see in pictures are different. The products that I used were really products that were aiding in burn. So when my skin started to break, I used calendula, and my hospital gave me this. My doctor's office gave me this, so it's not something that I had to buy. And then Silvadene. Silvadene really helped wrap it up. When we started using the Silvadene is when my skin started turning the corner. And so on the open areas is where I would use the burns, is where I would use the Silvadene. The areas that hadn't yet burned is where I was using the calendula. Then as areas healed is when I started using the Aquaphor. My doctors were really impressed by how well my especially because they were expecting me to have a really bad reaction. But I believe because I tried my best to stay hydrated during this process, and because I was very adamant, I was on it with my ointments and my creams, I believe that's the reason that my skin bounced back as fast as it did. And I continue to maintain the moisture in my skin today using cocoa butter, Aquaphor, and CeraVe, really a rotation, because I have my reconstruction surgery this year, and the skin still needs to be very healthy and very soft. So moisturizing is important, not just during radiation, but afterwards, especially if you're gonna have to do another reconstructive surgery. Well, that's it for me today, guys, for my experience on proton therapy radiation and how I kept my skin hydrated throughout the process and continue to keep it hydrated as I walk towards my reconstruction surgery in November. If you have any questions about my experience, or would just like someone to talk to about what to expect, feel free to contact me. Otherwise, I'll talk to you guys soon. See you next time.
Hey there, Brave Beauties. If you like to stay connected, be sure to follow me on Instagram at BraveBeauty26, subscribe to my YouTube channel, and check out my blog at blackgirlbrave.com.